Assalamualaikum and a very good day to everyone. My name is Dr. Aidalina Mahmud from Universiti Putra, Malaysia. The title of my presentation today is Looking Back to Look Forward, Tracking the ASEAN Government's Response to COVID-19 in the Pursuit of Post-Pandemic Recovery. As we know, ASEAN consists of 11 member countries: Malaysia, Singapore, Indonesia, Thailand, the Philippines, Brunei, Cambodia, Vietnam, Laos, and Timor-Leste. In 2019, the COVID-19 pandemic hit the world and, of course, the ASEAN region. Almost immediately, many countries developed and executed policies at the national level to manage the pandemic. By June 2020, with the anticipation that the pandemic will end soon, the ASEAN Comprehensive Recovery Framework was developed to assist in strategic directions for the recovery of COVID-19 in the ASEAN region. 5 broad strategies were identified, including advancing ASEAN towards a more sustainable and resilient future. However, the pandemic trend did not show much improvement in 2021. Therefore, in pursuit of achieving the post-pandemic recovery plans, the ASEAN members should first take a step back and analyze the pandemic situation in the region in terms of the related policy responses of each country. This review aims to track these policy responses and to determine if there are any gross association between the responses and the prevalence of COVID-19 within the ASEAN region between January 2020 and June 2021. The data for this review was obtained from the renowned Oxford COVID-19 Government Response Tracker and Our World in Data databases. In the Oxford database, the indicators were grouped into 4 categories as follows: containment and closure policies, economic policies, health system policies, and vaccination policies. This slide shows the indicators for the containment and closure policies. As shown, there are several policies, namely school closing, workplace closing, cancelling public events, restrictions on gatherings, closing the public transport service, staying at home, restriction of travelling between cities, and on international travel. For each of these policies, a country may respond in a variety of ways, either by doing nothing, which gives a score of 0, responding minimally, which gives a score of 1, responding partially, which gives a score of 2, or responding fully, which gives a score of 3, and so on. There are 4 economic policies, namely income support for households, debt or contract relief for households, fiscal measures, which is on economic stimulus spending, and international support, which include offers of COVID-19 related aid spending to other countries. This slide shows policies on the health system, which are public information campaigns, RT-PCR testing, contact tracing, facial covering, vaccination, and protection of the elderly. The scores of these indicators are aggregated into 4 indices: the Containment and Health Index, the Stringency Index, the Economic Support Index, and the Overall Government Response Index. In this review, data collected was on the ASEAN countries for the period between January 2020 and June 2021. Descriptive analysis was done on the indicators and the indices scores. The results were presented in graphs for easy comprehension. These graphs are then compared against the epidemiological curve of COVID-19. This graph shows the trend of the cumulative number of cases in the ASEAN countries between January 1st, 2020 and June 1st, 2021. As you can see, several countries, for example, Indonesia, Malaysia, and Thailand, have far more cases than other countries. This graph shows the trend of the daily cases in each of the ASEAN countries. As you can see, there are certain periods when there are surges of cases, also referred to as waves. For the ease of discussion, the ASEAN countries were divided into 2 categories, which are the high-burden countries and the low-burden countries, based on the total number of cases of COVID-19. Due to the interest of time, let us look at Malaysia as an example. This slide shows 4 pairs of graphs. Let us look at pair number 1. The top graph shows the number of daily COVID-19 cases in Malaysia, while the bottom graph shows the country's response to school closing policy. As you can see, when the policy response score was low, there was a corresponding increase in the number of cases, as shown by the red circles and the yellow arrows. Graphs number 2, 3, and 4 show similar findings. The same pattern is seen here in graphs 5, 6, 7, and 8, where the lower scores on policy responses corresponded to increase in the number of cases. This slide shows two graphs on the economic response. In general, Malaysia has consistently high scores for the policy response throughout the COVID-19 pandemic. This slide shows the scores for responses on health system policies. Graphs number 1, 2, 3, and 6 show persistently high scores for public information, testing, contact tracing, and protection of the elderly. As for the policy on facial covering, the response score has been increasing over the months, as you can see in graph number 4. In graph number 5, you can see that the response scores for the vaccination have also been increasing in the last few months. On this slide, the bottom graph is on the Containment Health Index score. The Containment Health Index combines lockdown restrictions and closures with measures such as testing policy and contact tracing, short-term investments in healthcare, as well as investments in vaccines. As shown here, there seems to be an inverse relationship between the index score and the number of cases. On the slide, the bottom graph is on the Stringency Index score. This index records the strictness of lockdown-style policies that primarily restrict people's behavior. Again, there seems to be an inverse relationship between the index score and the number of cases. On this slide, the bottom graph is on the Economic Support Index score. The index records measures of income support and debt relief. This slide shows that regardless of the number of cases, the government has provided good economic support for the population. On this slide, the bottom graph is on Government Overall Response Index score. Again, when there is a dip in the index score, there was a corresponding increase in the number of cases. Similar trend was seen in other ASEAN countries, but for the interest of time, we shall not go into each country. Let us look at one example on the policy of school closure among high-burden countries. There are 4 graphs on the scores for policy response to school closure, representing Indonesia, Thailand, the Philippines, and Singapore. As shown by the red, black, and green arrows, when there was a decrease in the score for public response in school closure, there was a corresponding increase in the number of cases. In Singapore, the policy response to school closure has been mostly low, but interestingly, the number of cases were also low, which may indicate that school opening may not be the main source of infection. This warrants further studies. Let us look at the index scores for the high-burden countries. On this slide, the bottom graph is on the Containment Health Index score. The Containment Health Index combines lockdown restrictions and closures with measures such as testing policy and contact tracing, short-term investments in healthcare, as well as investments in vaccines. As shown here, there seems to be an inverse relationship between the index score and the number of cases. As for the Stringency Index score, the pattern or trend is like the one seen in the earlier slides. For the economic support, it seemed that Malaysia, Singapore, and Indonesia have sustained economic support for the population regardless of the trend of COVID-19 cases. However, for the Philippines and Thailand, the economic support varied during the same period. This graph shows the government's overall response index score for the high-burden countries. Again, the similar inverse relationship pattern is seen here in this graph. Although not shown in this presentation due to limited time, further analysis of the data showed that several indicators seem to interrelate with changes in the EPID curve. They are school and workplace closure, restrictions of gathering and movements, and staying at home requirements. Countries with high burden of disease seem to have higher and more uniform scores of the Containment and Health Index, Stringency Index, and Government Response Index compared to countries with low burden of disease. In conclusion, although the findings show diversity in the responses among the ASEAN countries in managing the pandemic, it is noted that the higher the scores of policy responses, the lower the number of cases in that country. The ASEAN member countries may use these findings to learn from each other's experiences and ultimately develop the best practices in responding to the pandemic before working on the recovery plans, hence looking back to look forward. Further statistical analysis could be done to obtain a more objective value of these data. Thank you.